With us, we have Vincent Koinen from Andaman 7, Belgium, who will represent the point of view of a tech provider. Matteo Mauri from Cooperativa La Meridiana Isidora, Italy, who will represent a point of view of a healthcare service provider. Maria Nilsson from Family Care Competence Center, Sweden, who will represent the point of view of an informal carer. And Matthias Harald Wismar from the WHO Observatory Europe, who will represent the point of view of the policy expert. So, before starting the questions and the discussion, I will interrupt my sharing and I will leave the floor to the panelists to present, say some few words about themselves. So Vincent, do you want to start?
Yes, thank you. Thank you, Sarah. Thank you, everyone. Hello, everyone. I'm Vincent. I'm the founder of Andaman 7, which is a personal health record for patients, so a way for patients to have all of the health information with them on their smartphone with zero data in the cloud. And as part of that basic system, I would say, we enable clinical research, we enable care path, and we also enable a number of initiatives like frailty management. We have built a number of questionnaires like the classic ICOPE, MCRO, and others that you may know or have heard of, which are questionnaires to evaluate frailty and autonomy and the evolution of that. So this is being used in a project in Belgium by ergotherapists to try to quantify and to lead to policy or political decisions. And there's also a scientific study being run in parallel to that project.
Thank you very much, Vincent. Thank you. So, Matteo, do you want to introduce yourself?
Hi, everyone. Thank you for letting me be here. My name is Matteo Mauri. I'm project manager at Cooperativa La Meridiana, and I guide, the development and scale up of Isidora. It's our platform. Let's say it's a digital city platform for older adults. And, I'm from a non-profit. We are actually started as a volunteer association in Monza. We are outside of Milan. And today we count more than 350 professionals. So we are grown up. We mainly focus on providing care services in residential structures, in daycare, and at home. And we actually focus on, we try to focus on innovations. So for example, we built Il Paese Ritrovato, that is the first dementia village in our country, in Italy. And I'm actually here to talk about Isidora, our platform. So thank you for having me here.
Thank you, Matteo. Thank you. So Maria Nilsson, it's your time.
Yeah, thank you very much, Sarah, and thanks to all the presenters. It's been really interesting to listen to you all. My name is Maria Nilsson, and I'm a researcher at Linnaeus University in Sweden. My research is taking interest in older people and their informal carers, and I'm looking at how digital technology is being used to support them, basically. Further, I'm the director at the Swedish Family Care Competence Center. We say NKA in Sweden. It's a governmentally funded center of excellency, and we support municipalities, regions, and care providers in strengthening informal care support. And we work across all age groups and conditions, and serving as a bridge between research and practice. And we also is a national contact point for international collaborations. So my focus here today is a little bit about digital tools to support informal care, pros and cons. Many thanks.
Thank you very much, Maria, for being here. And finally, we have Matthias.
Sarah, thank you so much.
Thank you.
My name is Matthias Wismar. I'm program manager with the European Observatory in Health System Policies. We are an international partnership that supports evidence-informed policymaking, and we're doing a lot of monitoring, analysis, health systems performance assessment, but also knowledge brokering. And I'm here today because we've recently published a policy brief on closing the digital skill gap in the health and care workforce. And we've done this together actually in the framework of an EU-funded project, Be Well, led by European Health Management Association. Very happy to be here.
Thank you very much, Matthias. We are talking about adoption, user experience, the involvement of workforce, involvement of informal carers, which are very important, patients, and so on. So the first question is for you, Vincent. How can digital technologies help to reimagine long-term care services and long-term care in Europe, considering that we need to be sustainable and also we need to have person-centered solutions in the future? The floor to you. Thanks.
Thank you very much. Yes, that's a difficult problem, of course, right? There's all kinds of financial implications and then resources implications. For my part, being a software engineer, I'm trying to focus on the digital solutions that can help us human be in contact with others. And so I think that there is a movement in the past few years to develop standard questionnaires that try to have the agreement of everyone or the majority, and also that try to quantify things, right? Because if you say you are getting old or you are losing a mobility, okay, but to what level, right? It's a bit difficult to quantify, and quantification is, I think, important for one, seeing the evolution of the individuals, right? So to do a good work and to detect problems as early as possible, but also to guide the political choices and where the budgets are allocated in the hope that we will put the money where it's most useful, right? So I think that it may be a bit naive, but I think that the mechanism with well agreed upon questionnaires that are easy to distribute, easy to collect, easy to fill in by patients themselves, if they can, or by their carer, if they cannot, or close people like a ergotherapist or nurses or people that are taking care of those persons. I think it's a very good way to at least move the needle forward and to make things more concrete and more manageable than just, being in the soft skills, which is sometimes difficult to quantify.
Yes, so the need to involve always the users. So we are talking about the workforce, patients, carers who are supporting them, and understand very well their needs and help them in the co-design of the process.
I don't know if you see the screen here.
Yes, thank you.
Yeah, that's a simple example of a part of an ICOPE questionnaire. So very easy for a patient, right? Click here, yes, no, and then go to the next page and ask a number of questions. Of course, you have to do exercises at the same time. This is another questionnaire, EQ5D5L. This is a report that can be generated from the app of the patient to be sent to the doctor, and so the doctor can receive an evaluation of that. And of course, we would like to have better integrations, but at least an email and a PDF with the results is already pretty good. This is another example, MCRO questionnaire, as you can see here, with more information. So voila. So a number of simple questionnaires like that can do a lot, I believe.
Yeah. Thank you very much, Vincent. We see that the questionnaires are really important because we have seen that they are important for us to assess the organizations. Also, Mark put a comment here. So how to assess long-term care context, the services to deliver. So we see that we really need this kind of tools. So to move forward, I would like to ask a question to Matteo, since he has this experience with Isidora, with people delivering healthcare integrated long-term care services. So what real difference does digital tools in the lived experience of those delivering and receiving long-term care, in your opinion?
Well, first, this is a $1 million question. But, I think first I'd like to point out something. The first part should be that you should use this type of technology with the goal to amplify the human touch. Listening to the earlier presentations, I was really in accord with what were being said. Technology for the sake of using technology is mainly useless. The point is you have to amplify the human touch. And that said, we think that it's not only the instrument, how you use it. I'll give you an example, to keep things clear. Okay, with Isidora, we not only give, it's not only a healthcare instrument, but for example, we give them video content. We have a web TV inside that gives content tailored to older adults to keep them entertained and interested, and for example, doing some mental gymnastic or something to keep up with stay in high spirits. Because you cannot limit yourself to keep tracking data and taking scales and things like that. And on the second second thing, also on regard on how you use it. For example, we have inside a video call instrument, okay, a video call module. What we see is that when you keep using these modules for a long time, this becomes a normal occurrence, something that the older people at home, they are actually looking after, looking to come to. For example, there's appointment with the nurse. We do it once a week, and this actually reduces their stress and their loneliness. So to sum it up, for your question, I think that the actual difference is a lot, but it's not mainly centered on the tool, but in how the people around it use the tool to empower the elderly people at home.
Thank you very much, Matteo. Yes, so the point also I'm seeing in the chat, and I totally agree, is, and we are also talking here, digital technologies alone can't work. We need to engage people. We need to train, of course, them. We need to train workforce, and that's why we are moving to the second part of our discussion. And we can't leave patients or carers alone with technologies. We need to give them support with a trained workforce, trained carers that can use them in the right way. So I will thank you all for your precious contribution and comments. I will leave the floor now to Sofia, who will take care to ask the next questions to our panelists.
Thank you, Sara, and thanks for having me. Maybe I'll start by throwing some well-known numbers at you just to give us all, again, the big picture of what we're actually talking about. So we have a gross under prioritization of long-term care. We have 80% of the care that is actually delivered by family or friends. It's a huge percentage. And in other numbers, 1 in 5 of us are actually engaged in giving informal care, unpaid, to parents, to children, to people all ages that are in need of care. And of us, above 14% are actually also delivering care to people. So this is obviously a huge economic cost to society, because this is people who are missing in the workforce. And if carers drop out, there is loss of earnings, and so on and so on. And plus, on top of that, they don't get the visibility that they deserve. Maybe they're not invisible, like somebody mentioned, but there is definitely a historical neglect. Now, none of that is new. We've had studies commissioned by the European Commission, produced by London School of Economics 6 years ago, and also the European Observatory has done work on all of that. We still lack some clarity in terms of definitions and all that. And now we have two groups here. We have someone who is really talking on informal carers, and from you, Maria, I would like to know what can be done. Is it really an invisibility problem? Is it a lack of economic talk that we need a paradigm shift? And that goes also to Matthias, of course, because we've been talking about that. So what is it that keeps us from making policies more responsive to the need of informal carers, and what can informal carers do that lack a lobby? I mean, even formal carers lack a lobby. They have not been as visible and as loud as other professionals in healthcare. So this is a two-sided question. And how can informal carers inform policymakers, and how can we make policymakers more responsive to these needs in the light of this huge wave that is already there? It's growing more, and maybe the only good news is that once we are through, like we, the baby boomers, those of us over the hill, in 30, 40 years we'll be all gone, then the bulging population pyramid will normalize. But still we have to do something, and some of the tools can be digital, but maybe there is also some other policy levers that we haven't really explored. So who would like to start? Maybe Maria first, and then I have the $3 million question for Matthias, who will square the circle for us.
5 million, please. I don't do less than 5.
Okay, Maria, ladies first.
Yeah, many thanks. I think that was a brilliant sum up. As you say, it is well known, the issue of informal care, and I mean, it's really the backbone of long-term care. Without informal carers, there wouldn't be a long-term system working at all. And I would also like to comment on this. Invisible or whether visible, in my experience, I think that informal carers can absolutely be recognized, but they are often recognized as in a role to support the care recipient. Often so, or they can be recognized in a role to support formal care workforce. I still think they are rarely recognized as individuals with their own rights to support for their own health and long-term financial need, for example. One positive add-in to policy recent years is the European Care Policy, I think, which recognizes informal care as the other side of the coin, basically, to formal care. So I think that is a step forward in recent years. So I think that's really important from a policy perspective, that informal carers are recognized as part of the team, and that they really bring their specific knowledge to the table and are recognized as such. So if we're talking about digital tools and digital solutions, as they usually called, I think we need digital tools that work with informal carers, and we know very well what informal carers needs. Basically, they need access to information, they need support in coordination, and they need support for their own needs. What I haven't seen in the research and all the prototypes and pilots that are being presented is tools that could help balancing work and care, for example. I would like to see more of that. How can we support carers to balance and still be socially included in the workforce while still balancing care, for example? So that would be something I'd like to see more of, I think. And also I would like to take this opportunity to also talk about the evaluation of digital tools for informal carers. We must ask what they do for carers, because I have seen both in practice and in research recently that it's not always that they provide support for the carers. It might actually, some digital tools might add to the carers to-do list. They become like the informal IT support for the person that is being taken care of, and that is not necessarily in their interest. I mean, it's already the task list is already long, so I think that is something to think more about. So how we can include carers in the design, basically to consider them also core users in this case, not just the assistants in the periphery. I think that, did I answer the questions or did I lose myself in?
I think our heads are already humming and buzzing with all the input that we got. I think we could dedicate an entire session to each of your pilot projects and to your deep insights and thoughts. But thanks, Maria. I think it is very important to talk about engaging informal carers in the planning and in making the tools as useful as possible, and there is overall a fear, but maybe that can also be a typical situation of transitioning from one world into another world, that new doesn't necessarily replace old, but just adds on top of the tools that we already have. So there is some fear that can perhaps be alleviated or taken away by making the creation processes of these digital tools more inclusive and more engaging, and listening to the people who are actually going to use them. So that's on the practical, on the operational side. Now, what can health policies or health and social policies do to ease the pain of informal carers and to contribute to a paradigm shift and make it more common sense and more normal to actually listen to informal carers? And how can we bridge the symbiosis or the sort of reinforcement between formal carers and informal carers? Is that something where digital tools can help? And can you talk a little bit about the policy paper that you just mentioned that came out, Matthias?
Very much so. Thank you so much, Sophia, and thank you for framing the issue so effectively. I can even think about more challenges. And when I was listening to Oscar, I thought about all the innovations. Fantastic, they will play the trick and help us actually counterbalance it. But then I listened to Rachel, and I was hearing things like cyber maturity and readiness. And unfortunately, I have to tell you that in most countries, the health workforce is not cyber mature and not ready, even though in many countries we have the infrastructure, we have the gadgets, we even have the legal framework to do all this. But one of the key problems is to get the skills into the system, and also to use all the infrastructure we have in new ways, not just reproducing the old ways of working, but rather using them very perfectly. And just to give you, in terms of what needs to be done, we need to have information and data literacy. We need to have digital team building and communication skills. We need digital tools for content creation, copyright, safety and cybersecurity are key, and digital problem solving. And the way to do it is, of course, very much on the education side. We need to get rid of our digital arrogance, because in many countries we still believe, oh yeah, give us the tools and we do it, but it's not true. It's just not true. And some things actually are very basic. Some people would need to improve their skills in Microsoft Word, in Google, and that's certainly part of it. And just to tell you, Sophia, why we have difficulties to get this into the system, we were doing focus group interviews with healthcare leaders in countries. And what we heard was, especially in one country, they told us, listen, we have a health and care workforce crisis. We are very short, we have great difficulties to provide services. We don't have time for another training, all hands on deck. And this is a kind of catch-22. It's almost a vicious circle, but it's also a vicious circle because I think there is some ignorance, how to get this into the into the system, these digital skills. And, you know, at the interface with informal care, it's also about health literacy, honestly, you know, very basic stuff in health literacy. And the Be Well project, interestingly enough, they have not only developed a skills matrix, you know, what needs to be taught, you know, what sort of skills do health workers need, and different cadres of the health and care workforce need different skills. That's also very, very important to understand. They also develop training materials, you know, and online trainings. And it's not like you go for 4 weeks training somewhere or half a year you're out of the office, you know. It's quite discreet, very focused units, and you can do them over the course of the year, and it would really make quite some difference. So I think that we need to get agreement on the training needs and training opportunities, and that we also need to have the right ways to get this into the system. Of course, curricular development will be one thing, but we all know how slow it is, you know, and there are so many people involved in it. What will we get out of it? What we need is more continuous professional development and this sort of trainings. And unfortunately, I have to give you here a little bit of a not so optimistic news. We were collecting online resources for digital training for the health workers, and it's so hard, you know, across all the countries. There's so little, and the stuff which is sometimes really promising is short-lived. They are one-off attempts and so on. So we need to have this in a much more systematic way, digital training. And it's not necessarily super sophisticated. It's not super long, but we need to help people to use these tools. And Sophia, honestly, sometimes it's very, very basic. You know, it's very basic.